Good afternoon, respected professor and my dear colleagues. Here myself Siddhartha Patel from group L119 3B and my topic of discussion is clinical anatomy of soul. Now before we move to the anatomy of the soul, let's discuss what is soul. The skin of the sole of the foot is thick and hairless. It is firmly bound down to the underlying deep fascia by numerous fibrous bands. The skin shows a few flexure creases at the site of skin movement. Sweat glands are present in large numbers. Now coming to the joints of the sole, there are two joints present in the sole of the foot because they are the major joints for eversion and inversion of the foot. The joints are subtalar joint and transverse talar joint. The two joints can be seen in the photo. Once the skin of the sole of the foot has been removed, there is a very dense organized layer of deep fascia that runs down the middle of the sole. This is the plantar aponeurosis. The plantar aponeurosis is thought to help maintain the medial longitudinal arc of the foot. Now let's discuss about the layers of the sole. There are four layers present in sole. Let's begin with the first layer. After the plantar aponeurosis has been removed, you can see the muscles that make up the first layer of the sole of the foot and the arteries and nerves entering the foot. The muscles of the first layer are abductor hallucis, flexor digitorum brevis, abductor digiti minimi, and the nerves are medial plantar nerve, lateral plantar nerve. The arteries are branches of the posterior tibial artery and include the medial plantar and lateral plantar. The medial and lateral plantar nerves supply the muscles as well as the skin of the sole of the foot. They are branches of the tibial nerve. The medial plantar nerve supplies the abductor hallucis muscle, flexor digitorum brevis, flexor hallucis brevis in the third layer, and the first lumbrical. The lateral plantar nerve supplies the remaining muscle in the sole of the foot. In a way, it is similar to the ulnar which supplies most of the small muscles of the hand. The muscles supplied are abductor digiti minimi, accessory flexor, also known as quadratus plantae, adductor hallucis, flexor digiti minimi brevis, interosseous, and lumbricales 3, 4, and 5. Now, the second layer. When the flexor digitorum brevis is removed, the muscles of the second layer can be seen. They are accessory flexor, quadratus plantae, lumbricales, tendons of the flexor digitorum longus from which the lumbricales arise. The muscles of the third layer include the flexor hallucis brevis, adductor hallucis, oblique head, transverse head, flexor digiti minimi brevis muscles. And the fourth layer of the muscles are dorsal interossei meaning dorsal abduct, plantar interossei stands for plantar adduct. At this level, you can also see the tendon of the peroneus longus crossing the sole of the foot. Now let's discuss nerves of the sole of the foot. The medial and lateral plantar nerves supply muscle and skin of the sole of the foot. The medial plantar nerve give rise to digital branches which then give rise to common digital branches and finally the terminal branches. This nerve supplies the skin of the medial 3 and 1/2 digits. The lateral plantar nerve give rise to motor branches, a deep branch and finally branches to the skin of the lateral 1 and 1/2 digit. And arteries of the sole of the foot. The arteries of the sole of the foot are derived from the posterior tibial artery. It splits into the medial and lateral plantar arteries. The medial plantar artery passes along the medial part of the sole of the foot and terminates by branching into digital branches. The lateral plantar artery becomes the plantar arterial arch, which anastomoses by way of a performing artery with the dorsal pedis artery. The arc gives rise to several metatarsal branches, which splits into digital branches. Let's discuss ligaments of the sole of the foot. The long plantar ligament and the plantar calcaneocuboid ligament lie deep to the muscles of the fourth layer. The long plantar ligament stretches from the calcaneum to the cuboid and to the bases of the second, third, and fourth metatarsal bones. The plantar calcaneocuboid ligament reaches the calcaneum to the cuboid of the deep aspect of the long plantar ligament. The plantar calcaneonavicular ligament extends from the calcaneus to the navicular bone and prevents the head of the talus from pushing down between the calcaneus and the navicular bones. This ligament is also known as the spring ligament since it is believed to give a spring-like action to the foot when walking. Arches of the foot. All the bones of the foot are held together by ligaments, but there are three that are strongly implicated in maintaining the arcs of the foot: longer plantar ligament, calcaneocuboid ligament, calcaneonavicular ligament. The muscles of the foot have two primary functions. They are responsible for the movement which is made by during walking, and they also help to maintain the arches of the foot. The arcs are arranged both longitudinally and transversely and are caused primarily by conformation of the bones of the foot and the ligaments which bind them together, and secondarily by the muscles which act upon the bones. Medial arc. The medial arc is the higher of the two longitudinal arcs. It is formed by the calcaneus, talus, navicular, three cuneiform and the first three metatarsal bones. It is supported by muscular support, tibialis anterior and posterior, fibularis longus, flexor digitorum longus, flexor hallucis, and intrinsic foot muscles. And the ligament supports are plantar ligaments, in particular the long plantar, short plantar, and plantar calcaneonavicular ligaments, medial ligament of the ankle joint, and the bony part covered shape of the bones of the arc. Other are plantar upper lateral arc. The lateral arc is the flatter of the two longitudinal arcs and lies on the ground in the standing position. It is formed by the calcaneus, cuboid, and fourth and fifth metatarsal bones. It is supported by muscular support, fibularis longus, flexor digitorum longus, flexor hallucis, and the intrinsic foot muscles. And the ligament supports received by lateral arc are plantar ligaments, in particular the long plantar, short plantar, and plantar clavi calcaneonavicular ligaments. The bony supports are shape of the bones of the arc, and it also receives the plantar aponeurosis. We can see the same in the diagram. Transverse arc. The transverse arc is located in the coronal plane of the foot. It is formed by the metatarsal bases, the cuboid, and the three cuneiform bones. It has muscular support from fibularis longus and tibialis posterior. It receives ligamentous supports from plantar ligaments and deep transverse metatarsal ligaments. Other supports are plantar aponeurosis. It receives bony support from the wedged shape of the bones of the arc. Now here I have attached four tables from here regarding muscles of the sole of the foot. The first layer which can be seen in this slide, and now coming to the second layer you can see in this slide, and muscles of the sole of the foot. The third layer are located like this, and the fourth and the last layer is this. That's all for today. Thank you.